Okay, now let's talk about upper eyelid surgery. Upper eyelid surgery may be done for ptosis, which means the level of the eyelid is covering your visual field. Or it may be a pure blepharoplasty, which means the anterior portion of the upper eyelid, which includes the skin, the muscle, and the fat, may be sagging, or the brow may be sagging, or your lacrimal gland may be protruded or swollen. So these are the reasons usually we go for upper eyelid surgery. And depending on what we find during the examination, we can do just one single procedure, or we can combine these kind of procedures. For ptosis surgery, your muscle is either dehisced or your muscle is not functioning well. So there are different techniques to restore the function of the muscle that is responsible for lifting the eyelid. There are several techniques related to that. For the upper eyelid skin, usually we want to preserve as much skin as possible. One, to make sure we don't cause any scars. And the main reason is you need some certain amount of skin to be able to close your eyelid. So we don't want to cause any incomplete closure in the eyelid. The fat portion is critical because usually we have a fat protruding in the inside of the eyelid and another fat over here. But this fat usually as a volume, it decreases by age, but this fat in the inner portion of the eyelid, it keeps growing. So the idea is to remove this fat and to leave this fat alone so that we don't cause any trouble over the coming years. Also, there are some patients with a deep sulcus here, and a very good option is to move this fat, transpose it over to the middle or the lateral part of the eyelid so that we can get rid of the excess fat and fill in the gaps, fill in the hollows at the same time. If the patient has a lot of brow descent here, that surgery should be combined with the upper eyelid surgery. Otherwise, there's always extra hooding over the other side. So the upper eyelid surgery requires a lot of different approaches and a meticulous technique. So you have to find someone who is not only skilled but also very experienced in the eyelid area, and that is called an oculoplastic surgeon. So you have to consult your physician about your needs, about your demands, and then he will tell you what you need to do or what is to be avoided so that you don't have any complications after the surgery.